हेलो एवरीवन, आप डॉक्टर मोहन बेंकर इंटरनेशनल रेडियोलॉजिस्ट और इस वीडियो में हम बात करने जाने वाले एक ऐसे पेशेंट की जिनको बहुत ही घुटनों में दर्द था और रात को भी इतना पेन होता था कि वो अच्छी तरह से नींद नहीं ले पा रहे थे एंड शी इज कंसल्टेड टू लॉट्स ऑफ ऑर्थोपेडिक सर्जन बट एवरीबॉडी इज एडवाइज्ड टू गो फॉर नी रिप्लेसमेंट एंड शी इज सो मच confirmed by her mind that I don't want to go for any kind of knee replacement surgery. And ultimately, the patient ended up at my hospital, and we have done this new Japanese technique called Genicular Artery Embolization. Genicular Artery Embolization में हम क्या करते हैं कि जो जैसे हार्ट की एंजियोग्राफी करते हैं वैसे ही घुटनों की एंजियोग्राफी करते हैं और जहाँ पे पेन होता है, पेन वही जगह पे घुटनों में होता है जहाँ पे आर्थराइटिस की प्रोसेस कंटिन्यूअसली चालू हो और उसी जगह पे जब हम एंजियोग्राफी करते हैं तो हमको एब्नॉर्मल ब्लड वेसल्स देखने को मिलती है which is releasing the cytokines, and these cytokines are the inflammatory chemicals which are the responsible for chronic inflammation within the joint, and this chronic inflammation will ultimately erode the cartilage of the knee joint. cartilage जब erode होता है, जब उसको जो हम बोलते हैं घुटनों की गादी जिसको cartilage कहते हैं, तो गादी को जब डैमेज होता है तब नी जॉइंट में से पेन सिग्नल अराइव होता है. दैट्स व्हाई पेशेंट फील्स द पेन. एंड क्लासिकली ये पेशेंट की बात करते हैं तो रात को भी पेन का. तो रात को पेन कब होता है? जब ये रेस्टिंग पोजीशन पे है, जब हम नी जॉइंट का यूज नहीं कर रहे हैं, मतलब नॉन वेट बेयरिंग पोजीशन में भी अगर उनको पेन हो रहा है मतलब ये आर्थराइटिस की प्रोसेस बहुत ही एडवांस स्टेज में उनके घुटनों में चल रही है. और हमने उनको ये जेनिकुलर आर्टरी एम्बोलाइजेशन से ट्रीटमेंट दिया. जेनिकुलर आर्टरी एम्बोलाइजेशन का स्टेप बाय स्टेप मैं आपको बताता हूँ कि हम क्या करते हैं और कैसे उसकी ट्रीटमेंट करते हैं. Stay with me and look this video.
Hello everyone. So this is an interesting case of a 70 years old lady, and she has complained about the knee pain, particularly outer side of the knee joint, and she has a severe night pain also. So she is not able to take the sleep properly because of this pain into the knee joint into the night. And this is a pre-embolization angiographic image. And what we do that once we do this angiography, and we are trying to find out the culprit vessels which is involved into the inflammation within the joint. And while we're doing the angiography, these are the descending genicular artery, infralateral genicular artery, here the supralateral genicular artery. So these are the different arteries, but the infralateral genicular arteries are creating some vascular blush over here that is easily visible on this angiographic image. And so these are culprit vessels. So once we find out the culprit vessel, we do the selective angiography. So let's have a look on the selective angiography of infralateral genicular artery. So these are selective angiography. These are AP view and these are lateral view. Now all other vessels are not visible because we have done selective cannulation of the infralateral genicular artery with the microcatheter, and these are vascular blush seen into this angiography. And in lateral view we are able to see in much more details. These are patellar region and these entire course of infralateral genicular artery, and all these vascular blush, these moya blood vessels, which is a culprit for inflammation. So now we have identified the culprit vessels, we have identified the moya blood vessels. Now our target is to embolize it. We inject the 40 microns embolizing particle in these vessels, and let's have a look on the pre and post embolization angiography. So these pre-angiographic image which you have already seen. So these are the moya blood vessels, and these are early venous drainage over here. So these are artery, and once we inject these are the veins, right? So and these are post embolization image. So after embolizing of this infralateral genicular artery, the main vessels is intact, but all this vascular blush which was seen into the pre-embolization image, these disappears. So our target is achieved. We have embolized these small these particles, and we have embolized this infralateral genicular artery with the small particles. And let's have a look on the larger image of the pre and post angiography. So this is a pre-angiographic image of the image. These are taken from the popliteal angiography, and we shows the vascular blush into the inflammatory genicular artery. And now the same post-embolization picture shows there is no vascular blush in the area of the inflammatory genicular artery. So this is how we achieve our target. We have eliminated these moya blood vessels, and the main arteries, inflammatory genicular artery or other genicular arteries which are supplying the knee joint, they are still intact. So thank you so much. Hope you understand all these angiography images and how we treat this disease. And interestingly, the patient is get rid of this knee pain, particularly the night knee pain, with this procedure. So these are really magic for many patients, because we are not doing any kind of surgery, we are not doing any kind of anesthesia, with no cut, no suture, but still with this procedure patient's night pain improves significantly. Thank you so much.
So you have seen this video and आपको पता चल गया होगा कि हम ये genicular artery embolization में क्या करते हैं, how we process this, how we first identify the culprit vessel, उसमें embolizing parting inject करने के बाद यह पूरी की पूरी जो inflammatory process है, arthritis की process है, वो हम रोक देते हैं और patient को उससे benefit होता है. This is just one day procedure. कोई भी टाका, मतलब कोई भी stitch, कोई cut, कोई लंबा एनेस्थेसिया, ऐसा कुछ भी नहीं आता है, and patient can go back to their home with walking. So thank you so much, and if you have any kind of query, do ask me any kind of question on this procedure, and I will be very happy to answer all these questions.